We now come back to our conference, an initiative within the scope of the Portuguese presidency of the EU Council. We'll start our first panel under the topic Culture, Mental Health and Well-being. This talk will be remotely moderated by Pierluigi Sacco, Senior Advisor of the OECD, Paris and Trento, Professor at the Ulm University in Milan, and of Meta Lab in Harvard. Pierluigi Sacco, hello. I'll pass the floor to you.
Thank you very much. And thank you for hosting this very important panel on a topic that is becoming today one of the key topics in the international debate on policy, and especially so in this post-pandemic scenario. So the relationship between culture and mental health and well-being is an issue that is, of course, of special relevance in a moment like this, in which we could think that the whole of our society can be trapped into a sort of post-pandemic shock syndrome, so to speak, a post-traumatic shock. And so in the future, it will be especially important to understand what can be the role of culture in rebooting, not simply the economy, but more generally our society and our functioning as human beings and as communities. From this point of view, this offers us an unprecedented opportunity to reflect on the role that culture has on the life of us human beings. I think that this topic has been in the air for a while in the scientific debate, especially in the psychological and neuroscientific debate, but it has failed to land largely on the public opinion and even on the policy design. So this is really an incredible opportunity. Just to reflect on quite a few things. What we know today is, for example, that as humans, we reward ourselves, and of course, this is also an outcome of our socio-biological evolution. We reward ourselves a lot when we make meaningful cultural experiences. Our reward systems in our brain and in our neuroendocrine system, in some sense, give a prize to us when we listen to music, when we hear interesting stories, when we engage in activities that are particularly stimulating from the cognitive or emotional point of view. This means that really culture is important for humans, and there is a clear evolutionary rationale for this. So we are just starting to understand what are the reasons, and this is not the place to delve deeply into the scientific background. But what is important to stress are quite a few important consequences of this. First of all, our notion of welfare and the role that culture can play in welfare systems is going to be deeply affected in the future. We have been trained to think that culture is very much about entertainment, that culture is about something that is as unrelated from survival needs as you can imagine. Many of us have in mind this sort of ideal Maslow pyramid in which culture and all the activities relates to that are in some sense a part of the self-realization dimension of humans that is the most remote and the least involved in actual survival matters and issues. But what we know today is, for example, and this has been largely proved by a long wave of longitudinal studies, we know, for example, today that the culture ensures to people an extra life expectation of around 2.5 years. So this clearly means that there is a literal relationship between culture and survival, and this is to do, of course, with purely cultural factors that have nothing to do with cross relations with income or education or the usual confounders that are typically invoked when this kind of results are presented. So this is the first point that is very important to understand. As humans, we live longer and better because we know also what are the effects on the psychological well-being when we are constantly exposed to culture. So this is one thing we have to reckon with, and we have to understand how to streamline into a coherent and full-fledged vision of what policy is, and not just cultural policy in the post-pandemic scenario. The second point is that we are starting to understand that culture is very much about social impact. So the social impact is important because, especially in this moment, of course, we want to reflect on what can really change things for people in a moment in which we are all deeply shocked and stressed. And again, culture has proved itself to be very active in this regard, and not simply in terms of what we have just considered, but think, for example, of the other dimensions that are today deeply affecting well-being, like, for example, social isolation and disconnection. Social isolation and disconnection today is considered to be a main pathological factor, unfortunately. In some sense, being socially disconnected is like being ill from a major illness in terms of the consequences on our health. So from this point of view, again, culture provides us with extremely rich and stimulating social opportunities where the social dimension is not simply a way to familiarize with other people or to have some social exchange, but again, it's also a way to deeply engage our body and our, for example, again, neuroendocrine system in ways that we are just starting to understand. For example, singing in a choir or dancing together have been shown to be extremely potent opportunities for people to dramatically improve in many different respects their well-being. And then there is, of course, the issue of trust. We are in a moment in which, for reasons that we all understand, we have been disrupting many of our social networks. And of course, for a relatively long period, unprecedented in the recent history, we have been forced not simply to isolate from other people, but in some sense to look at other people as potential threats. Not because these people were meaning to hurt us, but because, however involuntarily, these people could be actual threats in a pandemic scenario. So rebuilding trust and recreating conditions for people to literally access each other and trust each other is again extremely important. And also in this particular respect, culture has proven to be a very, very powerful platform. And there is today a rich array of experiences that explore all these potentials. And I'm particularly happy, by the way, that today we have quite a few concrete cases that will help us elucidate some of the potentials of the scenario that we are considering. I should also say that in my current position at the OECD is strongly focusing on culture today exactly as a lever for a new model of welfare and more generally as a way of social and not only economic development. We have been touching upon this issue, for example, in our recent note called Culture Shock, when we examined the reactions of the various national and regional and local governments to the post-pandemic scenario, not only in terms of immediate reactions, but also in terms of long-term strategy, how to create opportunities out of the current crisis. And we stress very clearly that this culture, well-being and health dimension is one of the most promising and one of the most forward-looking. This, of course, also engages museums and cultural institutions more generally in a different way. Again, we have been working at the OECD with a project with ICOM in creating a guide in the terms of the role of museums in the future of local development strategies. And again, I think it will be not simply useful or worthwhile, but necessary to integrate this new dimension of well-being into this comprehensive vision of what is the mission today for museums, what is the mission for libraries, what the mission for theaters, more generally for cultural institutions in the context that we are experiencing. And finally, this of course also closely connects to the new European agenda for culture. We know that at the core of the new European agenda for culture, there is this notion of cultural crossovers, and in particular, the crossover between culture, health, and well-being is one of the key ones that have been already singled out by the Commission as the red threads for the future cultural policies and the future vision of how Europe can contribute to do a new and more effective idea of culture as a key policy leverage. So I think we are in this moment really in the ideal, unfortunately, not necessarily from the point of view of how we feel or the condition we are in, but ideal from the point of view of necessity of opportunity to embrace these new scenarios. So I think that this panel in particular, and the fact that it's placed in the context of the semester of presidency of Portugal in the European Union, I think is really particularly welcome and particularly useful. So on the basis of these preliminary considerations, I am particularly happy now to give the floor to my panelists. I will briefly introduce them one by one when I give the floor to them. And I start with Ugne Grigaite. She's at the Lisbon Institute of Global Mental Health, and she's also a fellow of the Lithuanian Human Rights Monitoring Institute. So Ugne, the floor is yours.
Thank you. I hope you can hear me okay. I will share my screen. Okay, so thank you very much. My name is Ugne Grigaite. I am originally from Lithuania, and I've been working in the field of mental health, disability and human rights for over 15 years in various different roles. I am associated with the Human Rights Monitoring Institute and NGO Mental Health Perspectives in Vilnius, Lithuania. However, currently I am a PhD fellow at Lisbon Institute of Global Mental Health here in Portugal. So today I have been asked to give a very introductory, brief presentation in which I will aim to address these 4 questions. So first of all, what is mental health? What are psychosocial factors that impact and affect mental health? How can we understand those? And what is the human rights-based approach? Because this is often left out of the discourse when we talk about mental health and well-being, less and less so, but still it's quite important to look into what it actually means and why is it important. And also, of course, finally, how is it all relevant in the context of culture and today's conference? So to begin with, for decades, mental health has been across the world often either underrepresented or misrepresented. And there are many reasons for that, and still quite a complex field. And for many years, the predominant perspective in the discourse about mental health was very much biomedically based, and biomedical interventions, psychiatry, the field of psychiatry, and so on. Still, many people, when they are asked about what is mental health, first thing that comes to mind is psychiatry, diagnosis, mental health problems, and so on. However, it has been evolving and changing in the last few decades. The human rights-based approach has evolved. The biopsychosocial paradigm also has been developed and becoming more and more talked about. So mental health and well-being are no longer a matter for only the field of psychiatry and only the biomedical perspective. It is still a big part of it and an important part of it, of course, but there's more to it, and it's a lot more complex. And this complexity includes a combination of biological, psychological, social, environmental, and many other factors. So when we look at definitions of mental health, the World Health Organization defines mental health like this: a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. And this is one of the definitions. There are others, and the concept of mental health, I would say, is still an evolving concept. across the world, academics and practitioners and others have been discussing this definition given by the World Health Organization, which is of course very important, but questions have been raised. Does it actually encompass the whole complexity? And is it not too binary in a way? Because if mental health is just a state of well-being, then we kind of drawing a line. What is illness? What is health? What is good well-being, and so on? And it has been argued that mental health is a little bit more complex. And I've put another example here of a definition which says that it is a dynamic state, in fact, of internal equilibrium of every person, which enables people to use their abilities in harmony with universal values of society, basic cognitive and social skills, ability to recognize, express, and modulate one's own emotions, as well as emphasize with others, flexibility and ability to cope with adverse life events and function in social roles. And of course, harmonious relationship between body and mind represent an important components of mental health, which contribute to varying degrees to the state of internal equilibrium. So yes, it could be thought as being a lot more dynamic and less binary, and the boundary between health and mental health problems or illness is very individual and can be affected by so many different factors for so many different individuals. So it is difficult to define it more specific than that. And of course, there are not only biological, like I said, but also social, psychological, and other factors. And all of them are important. All of them are covered by different disciplines. And mental health of each individual is right in the middle. And that's why it is very important to have a multidisciplinary work, and this so-called convergence approach is very important, because it is important to integrate knowledge and thought processes and strategies and tools from various different fields and disciplines when dealing with matters related to mental health and well-being. And of course, it means not only working together between psychiatry, social sciences, and other sciences, but also in general, scientists and clinicians working together, global health professionals being involved, engineers, educators, the field of culture, of course, and persons with lived experience of mental health problems themselves, including their caregivers, and so on. Synergies between governments, academia, and various industries, of course, are also important. So simply responding to mental health problems like in the past, in mostly biomedical way, is no longer enough. Like I said, it's still an important part, but not the only part. And this part mostly addresses the mental health problems often. However, prevention of mental health problems, as well as promotion of mental health and well-being in all parts of human life are vital elements as well. So this brings me to the human rights-based approach. Regardless of who we are, where we are based, how old we are, and so on, any other background, we all consider our health and mental health to be our most essential asset. And the relationship between health, mental health, and human rights is very much interdependent and integral. So first of all, human rights violations negatively affect mental health. And this is a fact. It's been studied a lot and is quite obvious when we think about it as human beings. Secondly, mental health policies, laws, programs, and practices across the world, unfortunately, often hinder human rights still to this day. Such practices as coercive measures or involuntary treatment still exist. There's various examples of people being isolated, segregated, and only because they have mental health problems, and those are the responses and the services and the support and care they get. So I've put a few pictures here that I have taken in psychiatric hospitals as well as social care institutions in some countries in Eastern Europe. But such places exist, unfortunately, pretty much everywhere, and these are the places that people with mental health problems, who develop mental health problems, unfortunately sometimes end up living in for a long time, and having a really daily human rights violations happening to them every day, being stripped of dignity and autonomy and just all human rights that that they were born with, and that shouldn't be happening this way. So there's no question that this, of course, it's a lot more complex than that. There are also human rights that people in the community who have mental health problems face. This is just an example of one of very problematic areas of this field, being the segregation and institutionalization of people. And thirdly, on a more positive note, advancing and respecting human rights, of course, benefits mental health. And these benefits extend beyond just mental health. Of course, there is a close connection between physical and mental health too. So mental health is not a privilege, it is not a commodity, it is a human right. And we are all humans, we all have mental health, and we all have the right to mental health. So it is very important to always remember this when we talk about any matters in the field of mental health, that the human rights-based approach is very important, and it should be the foundation for everything else that we're talking about. And this brings me now to culture, which is also a human right, just like mental health. And I'm talking about our right of access to, participation in, and enjoyment of culture. The defense of cultural rights is inseparable from the achievement of human rights and fundamental freedoms that we're all born with. Culture is fundamental to human dignity and identity, and participation in arts and culture has a positive impact, as I was saying before, on people's lives, health, and well-being. Hence, culture's importance to the field of mental health and well-being, as well as to public health in general, is significant. Psychosocial impact is really great and really significant as well as being complex, of course, as everything else in mental health. But for example, culture's psychosocial impact includes the fact that it enables participation, it empowers community gathering, it provides social space for dialogue, of course, contributes to strengthening a sense of belonging and sharing and identity, and it encourages expression of everyone's potential and fosters autonomy, and so on. There are, of course, more examples, but it is clear that the impact that culture has on mental health and well-being is very broad, complex, and important. So in conclusion of this short presentation, I would like to say that I believe that unlocking of the potential of culture for social cohesion that is talked about in this conference is essential for people's mental health and well-being. And finally, just to stress one more time, it is a matter not only of individuals and society, a matter of social impact and public health, but it is also a matter of fundamental human rights. And that is my message. This is the end of my short presentation. Thank you very much for your attention. Muito obrigada.
Thank you very much, Ugne. Thanks also for being so on target in terms of the time constraints, since we are running a bit late. And thanks for highlighting this relationship between human rights, culture, and mental health, because although the debate is booming on the mental health and culture issues, the human rights dimension is often disregarded. So bringing this into the stage and under the spotlight, I think is particularly important also because of course, we, as Europe, we are facing lots of new challenges. For example, in terms of the global migrations, issues where both the human rights and the cultural access and empowerment, of course, are highly relevant, and they will become extremely relevant in the future programming. For example, this new cycle. So thank you so much for stressing these issues. And now it's my pleasure to give the floor to Isabel Ureiro. She's a professor of the Portuguese National School of Public Health and vice president of the National Health School, National Health Council. Sorry. So Isabel, the floor is yours.
Thank you, Professor Sacco. I would like to start by thanking the invitation, and as a public health practitioner, it is an honor to be here and to discuss the relevance of culture in health. One of the challenges that I bring you is the development of a culture where art will integrate the strategies for the promotion of health and well-being. I start by approaching what health means. I bring here some of the definitions that are better known and more encompassing. There has been some understanding about what health, each one of them means, and of course it has a very strong subjective component. This is This is one of the challenges about, one of the diagrams about the challenging aspects of health. We can see the importance of the socio-economic environment and how psychological features, and it's interesting to see here the relationship, the way how relationships and behaviors influence the brain and how the brain acts in different ways on our body, causing physiological changes that will influence health and well-being. The early times of life of an individual are decisive for building our neuronal architecture, and the central nervous system of the human being is only fully ready by 2.5 years. Of course that the genetic load is very relevant, but the environment is essential for the way how genes are expressed, and culture can, in fact, influence the way how the genetic burden or genetic load manifests itself. By all means, culture represents one of the essential factors that determines our health. And as we will see, art has a positive influence on mental health. And because mental health has an impact in physical health, as you've just heard in the previous presentation, involvement in art represents an opportunity to improve the quality of life of individuals. These are some of the definitions of art, and also some concern the involvement in art. Art integrated in our lives has a huge transformation power. And it's not just the creative expression that has an impact in our health. Even our own involvement in art, like attending cultural events, reading groups, museums, all this makes a difference. And involvement in art contributes towards a mitigation of the effects of environmental hostile environments, and the positive influence to mental health, perinatal health, and child development. It empowers for the self-understanding, self-expression, and empowerment. It helps to manage chronic stress. It helps to overcome social isolation, and it is associated with a lower risk of mortality, a better perception of happiness, greater resilience, and quality of life. To educate is to teach people to think, and to look at works of art challenges our interpretation. We are the ones that create the sense of things. And when promoting culture, you're also promoting literacy. Literacy is essential for life. And we know that those who have a very low schooling level comes more often to emergency units, stays longer in hospital, and they die more frequently. We know that involvement in art is important to mobilize different areas of the brain, increasing its plasticity and developing the most sophisticated levels of thought. We are the ones who change objects into art. My experience has shown me how much richer my life was when I tried to answer a request from my son. He said, "Mom, can you please paint Alentejo for me? I did not know how to paint a cork tree." But I looked at the trees, and nowadays I look at nature in a much more richer way. My life changed when I took up this challenge. Painting can also be transforming when we express our emotions when faced with the beauty of nature. The expression of our feelings helps to release tensions and to realize things better. We have here the solitude, loneliness expressed by Hopper. Another example is the music of Schubert. Desire and love expressed by Rodin. To sing, to dance, to express different ways of being in the world, to share with the artist and with the audience also shows that we have this transcendent and universal nature. The artistic expression helps us to acknowledge what we have in us that is more in depth. Art in the urban landscape can be used to draw the attention to very important messages. Here you have an example of maintaining the memory of historical events such as the Revolution of April 1974. Francisco Lotoro, a composer and a piano player, collected a whole set of partitures that were composed in the concentration camps during World War II that are a witness to the strength and resilience of those who survived and experienced the Holocaust. As very often there was no paper available, they would memorize it, the songs, the poems, and the survivors have told their stories. For Pablo Neruda, if you don't travel, if you don't read, if you don't listen to music, if you cannot find anything amusing in yourself, then you're dying a slow death. Expression and sharing of events, feelings, life experience reinforces the identity and self-esteem. It prevents anxiety, depression and stress, and it can be one way for populations to feel richer. Joint creativity is also a very important way towards empowerment. This is what we're talking about when we're talking about the Healthy Neighborhood Program. And this program is aimed at populations that are living in regions that are specifically vulnerable to the pandemics, such as poor learning skills, difficult access to health and labor, lack of resources to pay expenses, including food, degraded housing, overcrowded houses and without proper heating conditions, social exclusion, as well as a greater prevalence of diseases that worsen the possibility of COVID-19. This program, the Healthy Neighborhood Program, is based in public policies that believes in the capacity of populations to understand their needs and to be able to find solutions to fulfill these needs, and for this they receive financial support. This program represents a stimulus so that the more vulnerable populations, when faced with their realities, they can find together ways to improve, leverage of resources and strengthening the bonds of social cohesion and solidarity. Different systematic reviews that were carried out by Public Health England in 2018 lead to the conclusion on the positive impact of social cohesion on the population health, reducing the risk of mobility and mortality. In the summary of the applications for Healthy Neighborhood program, we could see the relevance that the different communities rendered to social cohesion and how they find in artistic expression one way to increase it, contributing also towards a better mental health. Art expression through music, dance, photography, theatre, histories, urban art, astronomy, they all have a place of relevance in the methods that were chosen to approach social cohesion, to mobilize creativity, to ease loneliness, to improve self-esteem, and to give increasing value to differences and identities. Therapy through creative art is the planned use and the creative use of arts to attain clinical objectives. These interventions stimulate a response of the whole of the brain towards repair, recovering and well-being through self-expression with the support of therapists. They activate adjustment capacities and they improve flexibility, self-efficiency and empowerment. For instance, music is particularly relevant with autistic children in the recovery of brain damage such as stroke, in the improvement of quality of life of people with Alzheimer, in decreasing physical and emotional suffering of cancer patients, as well as the side effects of cancer treatment. The empathic reflection related with the imaginary of the patient and with the feedback without any attitudes of judgment or confrontation, well, it helps to create a therapeutic environment through visual and plastic art that reinforce the motivation towards change. Also, to paint what we would like to see can translate the strength of our hope. Let's look at the body as an object and as a subject. Through dance, it is possible to integrate the emotional component, the cognitive, physical, spiritual and social component. It is specifically useful in patients with Parkinson, and it is quite effective in the prevention of falls in the elderly. In the theatre, there are situations as if, and this allows the expression and reflection on old and recent emotions, to test situations, to distance from these situations. It allows to have access to emotions and to change behaviors. A very important psychoanalyst in the beginning of the 20th century, Jung, had already stated the relevance of art when he said that art is life. The evidence of the role of art in health, understood as part of the biopsychosocial concept, has led some countries to choose policies that stimulate patients to be involved in art, and thus it is a driving force for the process of discovery and creative effort. You have here already some of the examples of some of these countries that already have policies and structures to support art through health. I think that we in Portugal must in fact place culture and health in a constant dialogue in order to see what we can in fact do together in an integrative manner. This movement, arts for all, or health for all, has to do with the motto of equity for all, health for all, and it is integrated in the biopsychosocial model of health that has as a goal an improvement of the environment, reorientation of health service in a perspective of greater proximity, contributing to public health policies. This is the Parliamentary Commission for Art and Health of the UK. The chair is the gentleman on your left, Michael Marmot. He is also a physician, and he is also the chair of the Institute of Health Equity. And he has in fact done a lot of research on the issues of equity and stress and disease. This report, Creative Health, Arts for Health and Well-being, suggests 5 ways towards well-being: to give, to be active, to keep learning, to connect, and to take notice to the simple things that give us pleasure. art can humanize health systems. One of the experiences that is taking place in Portugal since 2018 is social prescription, a model of integration and care between health and the social sector that allows to health units to respond to the non-medical needs of its users. It creates a network, a referral in the community and in the society that promotes a holistic approach that is focused on the social, emotional, and practical needs of the users. It allows to the health system to act upon the social components of health, contributing to the wide range of the objectives of sustainable goal and development, and to assure its own sustainability as it changes in a proactive way the context of life of the users. Involvement in art can become one of the types of social prescription to support the recovery or prevention of situations of disease or health. This is a group of painters and designers that has worked with me throughout these last months of the pandemics, and thanks to us all, we were able to preserve our resilience and well-being and mental health. Some of my sources of inspiration, and of course the references where that I've used to prepare this presentation. Thank you very much.
And thanks so much, Isabel, for this again quite timely and absolutely punctual in terms of respect of the timings that we had. You gave us an extremely comprehensive overview of the so many different ways in which culture counts today in the health and well-being domain. And giving this overview, of course, the natural question is why it took so long for culture to count as much, because it's so clear and there is an overwhelming evidence. So at this moment, the real problem really becomes that this has to go through the public opinion. It has to become a reference point for policymakers, which is still not yet, but I think that we really have the basis for moving in this direction finally. And with the next presentation by Mikael Oder Nielsen, who's with the Aalborg Culture by Prescription program and a musicologist, we have a very concrete way in which one of the several experiments going on at this level across the world, where really cultural experiences are used also as a part of medical prescription programs. So Mikael, the floor is yours.
Thank you very much. I will just make my presentation full screen. Yeah. Yes, thank you very much. My name is Mikael, and I'm working at the municipality in Aalborg in Denmark, where I'm the coordinator of this program, Arts and Prescription, or as we call it in Aalborg, Kulturvitaminer, Culture of Vitamins. The Culture of Vitamins started as a 3-year RAID project hosted by the National Health Department for citizens with stress, moderate anxiety and depression. And we were 4 municipalities who took part of this project. Here in Aalborg, we created a 10-week program with 3 weekly activities. And here in Aalborg, we have a health and culture administration. So it was a cooperation between the 2 pillars in the administration. And the purpose of the project was to give these participants who are on a sick leave with stress, anxiety, and depression a break from their illness. Several of the citizens have been ill for many years and can hardly remember what they are beside their disease. Everything has been about diseases, and for some of them, it almost becomes their identity. Then we also wanted to break the social isolation. When you have stress, anxiety, or depression, you do not have surplus to the social. You may withdraw or cancel in a big way. And the paradox is precisely that activities with others can be stress reducing. And we want to contribute to the cause that citizens meet or participants meet with others in the same situation as themselves. Then we also want to give them a better mental health. Culture vitamins are not a treatment option, so we do not necessarily expect them to get rid of anxiety attacks or depressive periods, but we hope that they feel that they can do something more in their everyday life, get a better mental health. That they sometimes feel happy or satisfied, and they can do what they have to do the tasks in their everyday lives. And then we also, of course, want them to get closer to the labor market. A lot of the participants we had in this project is very far from the labor market, and some of them is not even ready for a job. But if we could push them from being ready for an activity to be ready for work, it would be a really good success. Now I want to show some of the activities in the project, and we have some activities that were on every week in these 10 weeks. And common reading or shared reading we had on the program for the first 8 weeks out of the 10. And we wanted to create something that made them feel safe. So the same reader, the same room every time. And common reading is a method to share literature by alternating between reading aloud and conversation. Shared reading is based on the feelings and the thoughts that arise while reading, and the conversation is based on the individual reading experience as well as the life experience that each reader brings into understanding of the work. And when discussing action or fictional characters, it can be easier to talk about difficult things, as you do not have to put yourself on display, but you can talk based on the work's action or its character. Then we have singing or common singing. We also had this on for once every week, the first 8 weeks of the project. And the thing about singing or music is that it have several beneficial effects on body and mind. To sing well is then it's important to breathe properly. With the right breathing, you can stimulate the body and the mind to become much happier, healthier, less stressed, gain more surplus and energy, as well as increased concentration. And this happens, amongst other things, by increased oxygen in the blood, which stimulates the desire to be active, and it also lowers your heart rate. When we sing or otherwise participate in musical activities, our brain is constantly working to anticipate the situation and trying to figure out what is going on. And our brain is already coded in terms of the way music is structured in the Western world. And the music is built up by tension and release. And when a strong tension is built up in the music, our brains wants to have a release and bring us home. And when that happens, and it happens very often in the Western mainstream music, our brains triggers dopamine as a kind of reward. And that is what makes us feel joy or happiness. And it also fights the stress hormones. Then, in addition to the singing and the music, we also visit Aalborg's Symphony Orchestra. We do it 2 times, and you get all the effects that are told about the singing. This about where your brain wants to figure out what is going on, what is going to happen. But we also use this activity to talk about how can we use listening to music in our daily lives. How can we change focus from illness to something else, and maybe use this to have a rest, to maybe lower all the thoughts in our heads, in our minds. Yeah. We also visit the Kunsten, the Museum of Modern Art. We do that 2 times as well. And here we have explanations and discussions of the museum's collections, and we have workshops where the participants themselves have to work with art. And the creative process and the action between the participants can help to create a flow state where the participants only focus on the activity and thereby forget time, place, and maybe most importantly, themselves. In this way, a break from everyday life is created, and at the same time as you unconsciously express and work with yourself. Then we also have visiting a historical museum and something called Lindholm Høje. It's a museum of the Vikings, and getting to know the history of the city where you live in, or the surroundings of the city, it can help you to create a sense of belonging. So it's no longer just a place or a city where you live, but it's a place where you belong. And in these 3 years, the National Health Department had a firm called NIRAS hired to do a quantitative evaluation. And as you see here on the screen, that 96% of the participants says that it has been good for me to be a part of. And 79% says it has made it easier for me to be with other people, which was one of the purpose of breaking social isolation. And it's one of the cornerstones of the platform to enter the labor market again, I think. 81% said that it improved their well-being. And that was also one of the purpose that should give them a better mental health. And 48% said it made me better able to handle a job. And we discussed this result with the job center, and they were fully satisfied and said it was actually very good. Our midterm report showed that there was only 35%, and I think it became this higher because we introduced that I, just before the end of the course, took a conversation with each participant and his or her advisor at the job center, where we discussed the next step and what the participant has learned. So we are well satisfied with this because we also know that most of our participants are not attached to any workplace, so they are very, very far from the labor market when they start on the culture vitamins. And I think the time is running, so I'll just skip this one and tell you a short story about a participant called Jacob. We have all types of citizens, people with long higher education, and to people who are unskilled, to new graduates, people who have had a good and long working life, who are affected by bad luck, and people who had difficulty maintaining job with a long medical history, and people who have not even started their working life yet. But when Jacob, he is 47 years old, started at the Kulturvitaminer. He previously worked as an unskilled worker at Estrella. He has been working at slaughterhouses and some of the industry that no longer exists in Aalborg. And after he has been unemployed for more than 10 years, he became distressed, antisocial, introverted, and he spent the most of his time watching television, and he rarely came out. When I called him and told him about culture vitamins and how we were going to do in the process, and afterwards I asked him, how do you think this sounds? And I actually myself thought it sounded very interesting. And he said, well, there's nothing there that interests me. And later he actually told that he said the same to his advisor at the job center. But I convinced him to go into this program. He said, okay. And when we started the process, he really didn't like it the first 2 weeks. But then suddenly, when we were singing Beatles and ABBA, suddenly he gave himself in to singing along because of all the others. He could see how much they enjoyed it. And then he took this experience into the other activities. And he approached all activities with an open mind and believed that it guaranteed would be really good for him. So with this experience, as we approached the end of the process, he has said that he felt that it is nice to be a part of a community, and that he doesn't say no that often anymore. He thinks that all the activities has been some good experience, and he feels a little special because the cultural institutions also sometimes top the experience with some things that others cannot be allowed to. He has enjoyed that it has been a community and activities where it has been where there has been a focus on the activities and not the illness, and not all the problems that that people have in their lives. They have he has gained an increased energy level, increased self-esteem, more zest for life. He says that he gets less panic attacks, and he has improved his social skills and his ability to maintain relationships. So I'm not sure I'm on time as the others, but this was my presentation.
Thank you very much, Mikael. No, you were exactly on time as well.
Oh,
and
that's
you
good.
you gave us really lots of food for thought and inspiration. I was particularly pleased when you stressed, for example, how musical experience is so deeply grounded in the working of what we know today to be our predictive brain. So how important it is, for instance, to think of musical experience as a way to fine-tune some of the abilities that are today needed for what it's today called our allostatic regulation. So our capacity to function as bodies, vital bodies, and the role that the brain has in all this, of course, but the role that experiences like music have in fine-tuning the brain. And actually, your observations also in terms of the practice that you showed nicely connects with the idea that all the main neuroscientific approaches that we know today to the relevance of culture, predictive brain itself, the embodiment perspective, the extended mind perspective, the cognitive gadgets perspective, all of them give us different angles in terms of what counts today, why culture counts so much, and especially in terms of how we can transform this into a new disruptive agenda, not only just for cultural policy, as I stressed already, but more generally as a new approach to policy. So thank you very much, Mikael, for this very insightful presentation. And now it's my pleasure to give the floor to the final presentation by Sandro Risende. He's an artist and he works with the Manicomio Art Projects, a psychiatric hospital program in Lisbon. And Sandro, the floor is yours.
Obrigado, Pierre. Bem, boa tarde a todos. Antes de mais, se pudéssemos abrir um bocadinho a luz para os...
Maybe you could turn the lights. I don't have a PowerPoint presentation for you. I'm sure you'll be happy because we have to go We need to have lunch. This is a conversation. It will be important that I would love to have some feedback from you. I know I wasn't supposed to say this, but so I will start by saying some words. I would say that Manicomio, which means madhouse, is a project dedicated to something that did not exist, and it's something that we are always walking this path until it becomes an official path. We see, these types of paths when we go to see sunsets by the sea, and I have been for 22 years working every day. Our work is done every day at a mental hospital, and we work every day in the area of mental health. So this Manicomio project was born after 22 years of José and myself, but I am working on behalf, I'm here talking to you on behalf of a large team. I'm talking about everybody involved, the artists, the team that works every day, journalists. We have someone from semiotics who's responsible for the accounts. We have psychologists, psychiatrists, designers, and all artists. Why am I talking to you about this large team? Because it's very important that the mental health team has a very wide perspective in a very different way. If I had only a team of doctors, psychiatrists, psychologists, and nurses, that would have been very boring, because these people are able to have a very unbiased perspective, and they allow us to go one step further. Although I have a degree in fine arts, I have been working for 22 years at a mental hospital, a psychiatric hospital center. So it's important that these views from the outside that have no experience in mental health, that are always debating with us through their feedback, is very important to find new ways to communicate with people. As you know, this project was born 2.5 years ago. As you know, just over 1 year we had COVID, and we're still here. It's an open workshop. It has an open door to the public, and we share this space with the so-called normal people, or people that have not yet been diagnosed. We work with art and creativity every day without any pressure to create art. There is no such thing as a fixed schedule to create art. Art does not have a fixed schedule, and artists do have that possibility. They work when they want, how they want, with the materials they want, and they propose what they want to do. There is an active voice within this project, and it is not the voice of the leader of the project, because there is no such thing as a leader, but it's the active voice of each one of us. This is the only way that such a wide project can grow, when we all participate in the growth of the project. There is not the patient, there is not the user, there's not the artist. What we have is a large team that wants to show that there is a lot of dignity, a lot of value within each one of us, and with the people that we work with, people who have had an experience or have an experience of mental disease. Fortunately, more than just art, and let me just say a comment, art does not heal. All the environment around a workshop, and all the language, and all the dignity in the contact on one-to-one basis, and all the search for the entity of this individual, what this person is, what this individual is, the value that individual is. This is where we are working with when dealing with mental disease. A painting does not heal schizophrenia. Don't think about that. Art, and as an artist, art can be very frustrating. We cannot do things. You cannot sell. Why was that painting chosen over my painting? So if there is a constant language in the workshop of a dignity that is quite different from our project, we will be able to make these things last. So when we are working with mental disease within this project, we are working with the identity of this individual. We want to know what people are and what they do. And I was listening to your presentation, and you were all focused on your cell phones. I saw you. But paying attention to the other, or listening to the other, or to understand what the other person is very important for our daily life. And what we do with this project, this is what we do. And we work, and we give to that individual everything the person needs to go one step further. within the aspects that the person wants. There is no thing that is imposed on that individual. There is always a creative process that is a constant, daily, pressure-free process, and with a lot of dignity. This project is a human, dignifying project, also has a financial component, and most of all, it is an artistic project. Why is the financial component important? Once again, I have worked for 22 years at this psychiatric hospital center. Usually, when we are working in fine arts in the hospital, the concern is never the final result of the play. The doctor doesn't want to know about that. The nurse does not want to know that. But our main concern is the outcome of our work, is the end result, is the result of the work that we are doing, each one of us. We all work. Whenever we have an exhibition, we have to think about this. It is our responsibility to present something that is coherent, well done, that will allow to see the dignity these people have, to see the value these people have. So there's always this concern. This is something that also allows us to be always looking for what's best and what's best and what's best. This project is also a space that the brands are also looking for, and it's important because we're talking about instrumentalization. It only makes sense to be with the brands to have a creative process if we add value to the creative process, or to the it's only appropriate because we are not going to use disease for charity or for the easy part, providing social accountability. We are going to look into ourselves, and I'm talking about the whole team looking at us because of our value and not because of the disease that we might have associated with the individual. This is also essential for the creative process. We work with brands, but what's essential is that we have to implement our value. Very often we manipulate brands, and brands make money with us. It's essential. Brands, if they are with us, they have to realize that they have to make money. So we are a very valuable item for those brands. So the whole process within this project works like this. What are the most relevant parts? We have no walls. I'm going to say this again. We work every day with canvas, with sculptures, with computers next to each other. There is not a line of command. When someone needs something, they just ask. When someone needs a doctor, then you have a doctor the next day. When someone needs a psychiatrist, you have a doctor the next day, because there is no shame in talking about this. We are open to work, to discuss this with each other, and this, we feel like a family, and so people don't lose it. There are no relapses, or if they occur, or when there's a situation close to a relapse, there is no shame. And many of us, we are ashamed to go to the psychiatrist or the psychologist. There is no shame. And so we have a better quality of life and better well-being. This space is quite wide. It is shared with other entities, and it also allows to create with other people, and it's an open door. It is now closed because of COVID, but it's a totally open door. Everybody can walk in, can talk, can propose, can give ideas, can work with the project. I'm trying to be really practical because I know this is lunchtime, so any questions will be relevant. We also have consultations of psychiatry and psychology within this space, but for other outpatients. But right now it is full because we have an environment that it's not a hospital. It's not a clinic. It doesn't feel like a hospital or a clinic or a private clinic. It's a place where if you need a consult, you can choose where you want this to take place. And we have a very low cost, which is also relevant. We are also working very much in human rights, which is essential, because it's an absolute component, an essential component, not just for the artist, but for the whole team of the project must have these human rights assured. We are working with politics. We're trying to motivate our decision makers to work in this area in a more open way, and we have been working with all areas that make sense and to show that makes sense regarding this dignity and these values. I think there will be a movie at the end, so it will be great if you have any questions. Good morning. Thank you very much. I am familiar with the project of your team. I have a question. How can you have the involvement of the artists to be part of the project? How do you involve them? I can say this we give them dignity, but yes, we give them dignity. We have a huge waiting list. We have many requests. We have 200 people waiting because they hear, they know, and there is no appropriate response regarding dignity in public service. And this response we provide allows that many people come to us, and the first artists were chosen. Some of them were not chosen. They just sent their portfolio. There were only 5 I was familiar with. And some years ago, I did 2 surveys at the national level, one for the health ministry and another for the cultural ministry regarding art and the hospitals. And I saw some amazing artists that have no type of support. Human resources within the hospitals are very scarce or non-existent in hospitals. It's usually someone that has a shop in fine arts that goes and teach the patients. So they teach what they know, what they think is right, and what is important. Very often it isn't. And so we have here a huge work to be carried out. Finally, this year, we were able, working together with the Ministry of Culture, for the first project supported by the ministry, the first one of its nature in this area. And why do we keep saying this? So that there will be other artists that can work with other institutions and can also increase the value of this type of work of these people.
Thank you very much, Sandro, and thanks also for this stimulating
Muito obrigada a todos
question and answer. And
por estas
at this point,
questões. E nesta altura,
I'm sorry, but I also hear the translation when I speak. It's very difficult.
o orador está a pedir desculpa, diz que também continua a ouvir a tradução.
Okay, so if I could avoid hearing the translation of what I say, I could probably can say it. Okay, so thank you very much, Sandro. That was a very interesting. That was very interesting intervention. I'm particularly happy that you stressed a couple points that I think are worth noticing. First of all, culture is not a magical wand. It's not something that solves problems instantly because of some transcendent property. It's really something that has to be made real through hard work and through real coordination and dedication and trust building. And the second point is, of course, the authenticity dimension. How important it is not to instrumentalize this experience and to oversimplify the purpose of the cultural participation. Again, I hear the translation when I speak, so if I thank you very much. I have only a few minutes to wrap up because unfortunately we ran out of time out of the previous round, and so we don't have time for further debate with our panelists. It's a pity, and I apologize also with the audience, but we tried to do the best with the time we had. So what are the takeaways from this panel? Well, I applaud the decision of the Portugal semester presidency to highlight the importance of this particular topic. And since EU semesters of presidency are also about agenda setting, I really hope and I encourage Portugal to really put forward this very, very important milestone that they made in this conference in terms of future actions and especially agenda setting. In the European programming, which is ahead, for example, in Horizon Europe, but most likely also in Creative Europe, we will have space for projects in this regard. But it's also very important that, of course, at the Commission level, at the Union level, it's clear that what Europe is doing in this moment is also path-breaking in many respects. It's already been emphasized that it's not just Europe. These experiences are now really taking over all over the world. But nevertheless, Europe has a unique capacity today to put this in perspective, not just as an interesting line of action, but really as a strategic option in terms of long-term vision of societal development. So it's very important that these experiences do not remain a galaxy of interesting case studies, but really become a basis for a coherent and a cohesive policy action. This also means that not all member states in Europe at the moment are equally focused on this. There are a few countries in which this is really becoming, if not mainstream, clearly a big thread of activity, but there are also member states in Europe in which this kind of perspective is somehow still a bit vague or not even really under attention. So it's also very important that we raise the awareness, that we coordinate our effort, and that we make of Europe the platform for the experimentation and the policy development of a new cultural welfare perspective. With this hope, at this point, I thank you for your attention and for your participation, and I give the floor back to the coordination of the conference. Thank you very much.
Thank you so much, Professor Pierluigi Sacco. Thank you to all the participants. We will now watch a video on a project that Sandro Rezende mentioned, Umbilicornia. It's a brief film and then we'll have lunch.